What's going on, everyone? Happy Monday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery, whether it be from COVID or anything else that's out there right now, because we do know flu is on the rise as well. It is time now for the Monday pandemic update for Monday, November 6th, 2023. If you're new to my channel, maybe this is the first time you clicked onto one of my videos. Don't keep on scrolling on to the next one. This has to do with COVID. Yes, COVID and other viruses are out there. It never really ended. You may not hear much about it, but it is still a big deal. Therefore, I want you to pay attention to this because this could be some life-saving information for you. And if at the end you're convinced that, hey, there is still a pandemic, then give this video a thumbs up and subscribe to my channel down below. Today's theme is going to be about rising cases. We're starting to see places where cases are rising, even here in the United States. First off, we have to start with New Zealand. Their weekly update from October 30th to November 5th shows that new cases, 5,872. That is up by 1,938. That is a substantial increase. Reinfections, 2,823. Deaths, 51 deaths. That is actually up by 7. In the hospital, 212. That is down by 13. And in the ICU, just 5, but that is up by 2. So not good to see that their number of people in the ICU have gone up. And then we take a look at this. You have heard me mention from time to time about a JN.1. Well, it's looking like JN.1, which is a lineage of the BA 2.86 variant, is now starting to become dominant over in Paris. This chart I'm going to show you is wastewater. Take a look at this. Wastewater in Paris, yeah, it is rapidly rising. So that is not good to see. Let's switch gears for a moment and talk about flu. Arkansas Department of Health reports first flu death of the 2023-2024 season. So not only are there COVID concerns out there, flu is out there as well, and Arkansas now reports its first death. Going back to Twitter, let's cross seas again. Let's go to Australia this time, where COVID cases jumped by 600 in a week, ramping also on the rise in South Australia. So it's rising in Australia at this time. That's not good. Then we come over to the United States weekly update. And it's kind of a mixed update, and it looks like we are on the cusp of a nationwide rise. I'll explain. This is from BNO News, and they do a weekly update every week. And in the past week, there were 159,872 reported cases. That doesn't include at-home tests or anyone who does not bother to test or whatever other reason may be. The average, though, 173,510, that's down by more than 21,000. But stick with me here. I'm leading to something. States reported 50 out of 50. In the hospital, 13,002. That's only down by 34, so that's hardly a drop. That's not good. In the ICU, only down by 1,542, and this number is not good. Week after week after week, deaths have been well over 1,000. Here we go again, 1,333. Well, yes, that's down. That's still way too high. Average is 1,500. That's only down by 33. And here's the breakdown for this week's case numbers. They say reports from 30 states, 90,962 cases. Estimates for 20 states, 68,910. Total new cases, 159,872. Today's total is down 2% from last week. So that, my friends, is not good. And let's continue. We're seeing signs, early signs, that cases are rising in some states, while in many other states the numbers are down only slightly after big drops in the previous weeks. And it's states like California. It's these bigger states that are not yet rising. That's why the overall national picture is not upward. It's smaller states that have started to rise right now. And as you can see right here, cases increased in 23 states, but were down in some of the bigger states, as they say, California, which is why national figures were only down just 2%. Uh, that's not much. And yes, we know deaths lag cases. They say that here. The fact that it's still more than 1,000 deaths for now the 8th week in a row. Nearly 12,000 deaths were reported during the past 2 months. Does that to you sound like a pandemic that is over? Does that to you sound like something that's now turned endemic? I think that still warrants cause for caution and safety precautions because that's not good. And that was just, what happened with the backside of the summer wave. Not to mention that the winter wave always has more deaths than summer and more infections in general, with JN.1 being something going on right now in Paris. We know that JN.1 could eventually become a problem here in the United States in December. Any place where it's rising fairly quickly. So the fact, hey, in the last 2 months, 12,000 deaths alone, yikes, we're not looking good for winter. Let's take a look at air qualities for today. Then we will move on to heat-related illnesses, and of course the all-important Walgreens update. Some slightly good news. You can see here the middle section of the country. Not doing that bad. The east, we're still seeing some moderate, yellows. There are a few oranges out there. Generally just poor air qualities. Now we come out to the west coast, and we do see some reds out here still in California, caused by wildfires. Still a general mix of things in Washington and Idaho. Heat-related illnesses, they're still a thing, so because of that, we're still going to show them. Florida, there's still quite a few counties that are above average heat-related illnesses. Even a few counties in the Northeast. You're seeing things slightly better now on the West Coast than what they were. Still some counties, but not nearly as many counties dealing with higher heat-related illnesses than the national average. All right, let's head over to Walgreens now and see what's going on there. Pretty sure I had it up to date on there, but I like to refresh it anyhow. And taking a look at this week, national positivity actually dropped some, but I'm seeing quite a bit of white here, and that signals to me some states that are maybe not reporting. Current week's positivity, 26.2%. The prior week was 27.6%. Difference of down 1.4% total test, 7,466. For some reason, that is up from 6,838 last week. Don't know where that number came, because when we did last week's update, there were more than 10,000 tests. So I don't know, but the testing overall, though that looks like it's higher, it's actually down from the previous update. All right, we're not going to do every state. We're going to do some states in each region of the United States. And yes, we will do Alaska today as well. Since we did the wastewater update starting in the West Coast yesterday, let's start this in the East Coast. And let's start with Maine. I'm seeing bright red conditions there, which is not a good thing. Current week's positivity in Maine, 35.3%. The prior week, 18.8%. Difference of up, 16.5%. Total test, 17 versus 16. So tests are up by 1. They don't do a lot of testing to begin with. Bad levels of testing. But that's a big rise for the positivity. Up 16.5%. We don't like to see that. What's going on in New Hampshire? New Hampshire, 28.6% this week. The prior week was 35%. Difference of down 6.4%. Total test, 14 versus 20. This is a legitimate drop. Let's go to Massachusetts. Massachusetts, 31.3% this week. Prior week, 40%. Difference of down 8.8%. Total test, 16 versus 15. So, yes, this is a legitimate drop. Now what's going on in New York State? Whoa, this is not good. 50.6% positivity this week. Last week was 42.1%. Difference of up 8.5%. 154 tests versus 159. That's not that much of a decrease in testing. I'm going with, for this one, it's a legitimate rise, unfortunately. Can we do Connecticut? Let's see. Yes, we can actually do Connecticut. Connecticut is flat, 21.6 versus 21.6, and testing is the same as well. New Jersey this week is 19.7% positivity this week. Prior week was 26.8%. Difference of down 7%. And total tests, 208 versus 213. Pennsylvania, 24.4% this week. Prior week was 28%. Difference of down 3.6%. Total test, 90 versus 82. Let's come down to the south now. Down in the south, we see Florida, 18.8% positivity this week. Prior week was 22.2%. Difference of down 3.4%. Total test, 857 versus 757. Testing down, and we are noting that there is a drop in positivity. So, yeah, I think this is a legitimate drop. I'm seeing some red in Alabama. What's going on there? Yikes, this doesn't look good. 25% positivity this week. Prior week, 17.1%. Difference of up 7.9%, and testing is up 100 versus 76. Unfortunately, this is a legitimate rise at this time. Let's continue on now with Tennessee. Seeing red here as well. 24.4% this week, 18.4% last week. Yeah, it's up 6%. Testing's up 234 versus 201. So, yes, this is a legitimate rise. And you are seeing here, at random, every state is different at this time. You could probably correlate what I just said to the wastewater update yesterday as well. We're seeing some states are dropping, some states are rising. BNO noted that there are 23 states currently rising, and I mean, you could see states within a region where some are dropping, some are rising, and that's what we're seeing here. It looks to me, though, as if there's something that's spreading from the Midwest and has now made its way into Tennessee, down into Alabama. How about Kentucky? Has it made its way there? Yeah, it has. 34.5% positivity this week. 26.4% last week. That's up 8.1%, and testing's up as well. 113 versus 106. We've been watching Indiana as well, and look at this. Indiana, I'm going to go with this as a legitimate rise too. 34.5% this week. Prior week was 29.7%. Difference of up 4.8%, and look at this. 119 versus 118. Yeah, just one test more, but you can see here, it's definitely rising again. There was a sharp rise and a sharp drop, and now yet again it is going up. Illinois, what's going on with you? Yeah, Illinois is rising as well. Like I just said, there is something that is spreading from the Midwest and making its way southward. Very unusual that we would see these states rise first. I don't know if there's an undetected variant, but it's really strange what is going on there. Illinois, 31.3% this week. Prior week, 26.8%. Difference of down 4.4%. Total test. This is a big increase in testing. 627 versus 563. And how about Iowa? Yep, legitimate rise here as well. 35.3% versus 19.4%. Difference of up 15.9%, and at one point last week it was actually up even higher, to 57.1%. 34 tests versus 31. Again, tiny amounts of testing in some of these states, but it is definitely something that we have to pay attention to. Let's go to the West Coast, then we'll go to the South Central states. Just going to do a couple states in the West. California, 27.1%. Prior week, 30.1%. This is a legitimate drop. 2.9%. Total tests, 258 versus 193. Can we do Washington? Yes, we can. 24.8% versus 25%. Difference of down 0.2%. 109 tests versus 108 tests. That's a legitimate drop. I am seeing this in Oklahoma. What is going on here? Wow, Oklahoma, legitimate drop, or excuse me, a legitimate rise, and this is a state that really bothers me. If you live in Oklahoma and you're watching this, please write to your state's health department and ask them to do more wastewater monitoring. Is there a page on Oklahoma's websites that I don't know about? Because I cannot find any wastewater for Oklahoma. If you know of any, please share it with me down below, because Oklahoma needs to get on the ball with wastewater. All right. With Walgreens, Oklahoma is 28.6% this week. Prior week, 20.9%. Difference of up 7.7%. Total test, 84 versus 67. And we're going to do one more state, and that is going to be Alaska. 9.1% positivity this week. The prior week is 10%. Difference of down 0.9%. 11 tests versus 10 tests. This is a legitimate drop. And real quickly, I should add, you can see here, I mentioned Oklahoma. That spread that's coming here from, just south of the Great Lakes, portions of the Midwest, it's made its way there, because you can see Arkansas is also rising. We'll look at a couple more states again tomorrow. Let's take a look now at the latest variants. HV.1, 25.2%. EG 0.5, 21.9%, and FL 151 at 12%, with a whole slew of variants below 10% at this time. Latest hospital admissions, 15,745. That's on the national level. Yesterday, Philadelphia had 789 EMS incidents. Taking a look now at a live look in at what's going on with the suburbs of Philadelphia, Montgomery County, there's one respiratory emergency call, few other things. Not terribly busy, only 11 calls right now, and we want to see what's going on in Chester County. I have to refresh this. It's been having problems all day long. Actually, it's working now. Earlier, I couldn't even get it to load. There's a few calls going on there. Heart problems, another heart problem, respiratory difficulty, syncope. Yeah, we're seeing some things going on there. But again, not terribly busy, so that is good to see. New Jersey, less hospitals reporting today. 62 out of 70. And that results in 354 people in the hospital. We know their hospitalizations have been dropping, but this number is likely underdone. 7 people on a ventilator at this time. And taking a look at the ICUs, 28 people in the ICU, and I'm assuming the discharge number could be off. It's saying 53, but with not every hospital reporting, who knows if that's actually a correct number. It probably isn't. It might actually even be underdone. I don't know. But with all hospitals not reporting, you have to assume some of those numbers are off. New York State, 1,134 new cases on the most recent update. And then we come over to New York State hospitalizations. They continue to drop, 1,148. We'll see what tomorrow's number is. I suspect it'll be higher than today's number, but I suspect it will probably continue the theme of an overall drop. And at some point, we will see New York State rise. Don't know when that's going to be. Will maybe be this week? Will it be next week? You have to think Halloween did something in New York State. Of course, the big kaboom, as we all know, comes at the end of this month. Thanksgiving, and then the wild card with JN.1. Alrighty, we're not going to take a look at worldometers today. We already took a look at a few international numbers. I will end with this today. You just saw a bunch of data from around the world, and here in the United States. You can clearly see in some areas cases are rising. Let's go back to Walgreens for a second. You can clearly see here something is going on from the Midwest, from Iowa, Illinois, Indiana, Kentucky, Tennessee, down to Alabama, Arkansas, even back into Oklahoma. There is something that's spreading there. And we're not just seeing the rises there on the positivity trackers at Walgreens. We're seeing a few wastewater sites rising as well. So it's something we're going to have to keep an eye on. I'm not hearing any rumbles of a homegrown variant here in the United States, but you know what? We're going to keep our eyes out for it. Alrighty, folks, if you were convinced that the pandemic is not over, or you like this video, give it a thumbs up. And of course, if you want to see more content like this, subscribe to my channel down below. And I will see you all again next time. But before I see you again next time, you need to share this with anyone who you may think needs to see this. And of course, stay safe. The key to the ball game is staying safe. Test if you feel sick. Mask if you're going out in public. You know, all that stuff. It's not that hard to do. It's fairly simple. I will see you all again next time. Thanks for watching and enjoy your Monday afternoon.